Scott Cline, a neurologist here at Hendricks Regional Health, predominantly doing inpatient care, including things like stroke. So I've been looking into using telemedicine in really various aspects of what we do here, but one of the things that we take great pride in is our stroke capabilities. And so we were working on a way to get our door-to-needle time down, which is how fast we treat somebody from the time they arrive to when they finally get the drug to treat stroke. And I started thinking about, could we do some of the evaluations en route as opposed to wait until the patient shows up here? And so, yes, through some Google searches, I found someone who was actually doing something similar at University of Virginia, met up with him at a conference, neurology conference, and talked to him about, hey, how do I get this up and running? And he kind of walked me through how they started their program, and so I reached out to our ER docs and kind of said, hey, this is something that we can do, and next thing you know, it's off and running.
I'm Jim Nossett. I'm an emergency physician here at Hendricks Regional Health and also an EMS physician. Well, we say time is brain, and literally that's the case. When somebody's having a stroke, every minute 2 million brain cells are dying. And so if you compound that 5 minutes, 10 minutes, an hour, you're losing a lot of brain, and therefore the disability is going to be much, much worse. And so literally when people are having a stroke, we always tell people, if you think somebody's having a stroke, call 911. Don't try to get them to the hospital yourself, and certainly don't wait to see if it all gets better, because really time means everything. And so that's what Telestroke is all about. We are trying to cut off the time that from the time the patient arrives to our hospital to the time they can be treated. And that happens by doing some of the things we normally would do in the ER in the back of the ambulance.
Essentially, we just use the FaceTime app. It's a one-to-one connection, so it's compliant and safe, but it's as simple as you turn the iPad on and swipe it, and FaceTime is there. It rings the ER, and so the ER doc answers, and all of a sudden they're able to get a history from the patient or from the EMS paramedic. They do the exam together, and then everything flows from there. So yeah, it's as simple as an iPad here and an iPad there. You know, the mobile Telestroke, like I said, had some birth in University of Virginia, but in terms of around here, we're the only one doing it en route.
Most strokes are caused by a clot blocking the blood flow to part of the brain. And if the patient can get to us soon enough, and it has to be within a matter of 3 to 4.5 hours at the most, we want it to be way less than that, but if they get to us soon enough, we can give this drug called TPA, which literally breaks the clot up and can restore blood flow to the brain. And we have seen some remarkable results when we give this drug. Some patients come in, literally can't speak, maybe even paralyzed on one side, and they get the drug, and within an hour or so, they're talking to their family again. And I know they're going to walk out of this hospital. And that happens in some stroke patients. And again, time is of the essence. If we can get that drug to them as soon as possible, then they have a much better chance of having way less disability, maybe even be completely normal. Well, Hendricks Regional Health is, we've gotten a 5-star grading by Health Grades, which looks at our care and our quality and says, that's tops, that's as good as it gets. And that happens because we've got so many people from the administration all the way through the physicians, nurses, technicians, secretaries, everybody is really committed to, our motto is treat people better. But our goal is to do everything we do with the utmost quality. And part of that is innovation. An idea like this is really truly innovation. It's came out of the minds of our neuro hospitalists who said, what do you think about this? Let's try this. So our goal is always to be on the forefront. We want to do things the best. We want to do things with the highest quality, and it makes a huge difference.